What type of seizure is most likely responsible for this patient's gustatory hallucinations? Absence seizures, atonic seizures, myoclonic seizure, tonic-clonic, or focal onset seizure. A 60-year-old man with a history of hypertension and AFib presents with episodes of experiencing a strong, unpleasant taste in his mouth, even when not eating or drinking. These episodes last for several minutes and are followed by confusion and difficulty speaking. What type of seizure is most likely responsible for this patient's gustatory hallucinations? So, okay, I really don't know 100% what he has. I always thought this was like a temporal lobe issue when you have like gustatory hallucinations. I thought I was like, I just for some reason didn't think gustatory is temporal lobe epilepsy.
Mhm.
Actually, with that, I'm gonna go with focal onset as my gut. Absence seizures or absence seizures are more in children who have blank stares. Atonic means literally atonic. You are gonna start like falling to the ground with no tone or like without tone. Myoclonic is rhythmic jerking, and so you'll have like very back and forth, like very rhythmic jerking of like the leg. And tonic clonic, I believe, is like a grand mal seizure, and that's very clear that you're having a grand mal seizure. It's the one that people think of, and so I'm gonna go with this as a focal onset.
Yeah, good. Perfect. I think you worked through that beautifully, right? So focal as in kind of stems from a certain part of your brain, right? Especially if they're telling you it's gustatory, then likely it's the temporal lobe. Absence, right? Usually lip smacking, you can get eye blinking, staring off the space, usually in pediatrics. Atonic, right? Like you said, you lose muscle tone, so you can kind of like fall, all right. Myotonic, like you said, brief involuntary muscle contraction or jerks, and then grand mal seizures, right at the end.
What's
So good.
funny is that I didn't know what these really were, and I was watching your YouTube videos, and you had walked one with somebody, and y'all talked about focal onset versus tonic versus, and I didn't know what focal meant. I just thought, okay, that's something, and I didn't know that meant a specific part of the brain versus diffuse or generalized is the
Yeah.
whole brain,
Yeah.
and so I learned that through your YouTube videos.
Yeah, good man, good. Yeah, exactly. Definitely for sure. The ones that obviously that you're not a part of course, right? But the other students that I tutor, it's definitely helpful so that you can kind of speed up the process. So it's like me walking you through the same question, right? So